The second part of our lecture about the scalp and the face is the anatomy of the face. And the face as a region present or visible in the anterior aspect of the head is the area extended between the hairlines above and the tip of the chin below, and laterally extend to the points of what is called the external ears. Now the face as a region contains important openings of, for example, the mouth, the nose, and the orbit, both on each side. And the skin of the face, more or less, is thin, and it is very sensitive to, for example, the pain, temperature, vibration, and even tactile sensation due to its richly supplied by cutaneous innervation. And sometimes the skin of the face might be hairy, containing a lot of hair follicles, especially in men. The face contains variable amount of fat according to the race and according to the gender. And the important point here is there is no fat in the eyelids, and also there is no deep fascia in the layers of the face. And actually, the absence of deep fascia might be the cause behind the wounds and the laceration of the face to be gaped and even everted and opened. With tally, continuous bleeding might be expected from laceration and wounds of the face. So the face wounds and laceration should be sutured. The important part of the anatomy of the face is the muscles that forming the main architecture of the function of the face and even the facial expression as well. And these muscles in the face arranged around the opening of the face we mentioned just before, like the opening of the mouth, the nose, and even the orbits. So these muscles around these openings act as a sphincteric mechanism, try to close or to narrow the opening of the mouth, of the nose, and even of the orbit when we are closing our eyes. And also we have another muscles that antagonize the action of these sphincter mechanism muscles. We will come in a moment about these muscles. So the first important muscle group around the opening of the mouth, we call them first the orbicularis oris muscle. It is around the opening of the mouth, and from its name it is circular in manner and try to close the mouth or even to protrude the lips of the mouth when it is contracted. Now this muscle forms the greater part of the substance of the lips, under the skin of the lips. We can find the muscle that forming the bulkiness of the lips is the orbicularis oris muscles. So the contraction of this muscle will cause narrowing or even closure of the mouth opening. Other muscles present in the face, like the buccinator muscle in the cheek, also the levator and the presser muscles present around the mouth, they are very important, and they are actually reinforcing the function of the orbicularis oris, the main muscle, and also blended with it. So there is no actual bony insertion for the depressor and levator muscles. They are blended with the orbicularis oris muscle. We have another muscles like the levator labii superioris, causing elevation here, elevation of the lips. And also we have the depressor anguli oris, from its name, causing depression of the angle of the mouth. We have bilaterally here the depressor anguli oris muscles and the levator labii superioris present here in this region, causing elevation of the lips. The other points for the buccinator muscle, it is a flat muscle and present in this area in the cheek, and actually it is a muscle of mastication by pressing the cheek against the teeth and preventing lodgement of the food in the vestibule, what is called the vestibule area inside the oral cavity. So the buccinator muscle forming the main substance or the bulk of the cheek. It has bony attachment to the outer surface of the maxilla and the mandible, and also it is attached to the what is called the pterygomandibular raphe. So the upper attachment here to the maxilla and the mandible, and also it has attachment to the pterygomandibular raphe here. Now this muscle, as we mentioned, to prevent lodgement of the food particles in the vestibule of the oral cavity, and also can aid in increasing the air pressure in forced blowing, like those in the persons who are trumpeters in the, for example, in the orchestra. So these muscles of the face, as we mentioned, they are around the opening of the mouth, while the other muscles around the nose or concerning with the anatomy of the nose, like the procerus muscle, which is derived from the occipitofrontalis muscle here, and it draws the medial portions of the eyebrows here and there down inferiorly and producing the transverse wrinkles here over the nose bridge. So this maneuver can be produced when the person tries to glare the bright sunlight facing him or her. So this is the contraction of what is called the procerus muscle that produce this important maneuver to prevent or to glare the bright lights facing the eyes. The other parts or the muscles that called compressors of the nares or dilator, we call them compressor nares muscle and dilator nasal muscles. These are small in size vestigial muscles, but they play a role in elevation or depression of the alla nasal, even in those persons try to take a deep breath, and those who are dyspneic person or have shortness of breath, they are so evident in this situation or conditions when the person try to open the nostrils of the nose by the action of these muscles, dilator nasal or nares muscle, and the contrary of that is the compressor muscle. The other important muscles in the face, those around the opening of the orbit or the eyelids here, we call it the main muscle, we call it the orbicularis oculi muscle, and actually it is surrounding the palpebral fissure here in the anterior to the eyeball, and it's composed of two main parts. The palpebral part of the orbicularis oculi muscle, actually it lies within the substance of the eyelids and attached to the medial palpebral ligaments, and also to the frontal process of the maxilla more lateral. So here we have the orbicularis oculi palpebral portion, while the more peripheral part of the muscle, we call it the orbital portion, orbital part of the orbicularis oculi muscle. In actual fact, this part surrounding the orbital margin and attached also medially to the same medial palpebral ligaments, and laterally to the frontal process of the maxilla. The fibers of these parts blended with the occipitofrontalis muscle, and we mentioned that when it causes elevation of the eyelid and opening of the mouth of the eye. The significance on the role of the orbicularis oculi, functional speaking, the palpebral part, which is present within the eyelid, causing closure of the eyelid in a light manner, like the closure of the eye during sleep, and even the blinking. This is due to the contraction or the palpebral part of the orbicularis oculi muscle. This action of the muscle or this part does not decrease the size or the volume of the conjunctival sac, while the contraction of the peripheral part of the orbicularis oculi, namely the orbital part, it will cause the positive closure of the eyelids, like in frowning here in this person. When the frowning, it means the forceful contraction of the eyelids, like for example in our life when, for example, the irritating substance, when it is enters the eye, the person try to squeeze his eyelids, trying to pull out these irritating substances, and this is called the frowning of the eyes, like in the picture here. In actual fact, the contraction of the orbital part of the orbicularis oculi muscle decrease the volume of the conjunctival sac, and eventually it will spill out the tears present in front of the eyeball. So the film of tears might be spilled out during the contraction of the orbital parts of the orbicularis oculi muscle. Actually, we have a muscle here, very important. I think we mentioned it in the lecture of the anatomy of the neck, and also we can repeat some important points here. The platysma muscle is a broad flat sheet, the superficial muscle present within the superficial fascia of the neck layer, and superiorly this muscle passing over the mandible and blended with the muscles of the mouth here. This is the platysma muscle, while inferiorly it is blended with the superficial fascia over the upper part of the chest here. And actually and functionally speaking, the platysma muscle is regarded as one of the facial expression muscle, and also it might cause a weak depression of the jaw. We can elicit the main role of the platysma muscle when the person or the man trying to shave his beard, and this muscle will be contracted to stretch the skin of the lower part or the chin and even the neck. Now this slide concerned with the two important conditions as a clinical relevance in our topic regarding the anatomy of the face. And just to remind you that the sensory supply of the face is by the branches of the trigeminal nerve, while the motor supply of the face by the branches of the facial nerve. Now, if we have palsy of the facial nerve, so we will have a paralysis of the muscles involved on the side of injury. وبالتالي, when the person tries to express himself, for example, angry or even happiness or even weariness, so the contraction of the muscles of the face will pull the face to the normal side. This is the normal side here. When these muscles here present, they are acting normally by the presence of the facial nerve on the left side, while the right side here is paralyzed. وبالتالي they are weak muscles and atrophied. So the face will be deviated to the normal side due to these facts. While here in this picture, we can state that the infection here is a viral infection with a blister formation in the distribution of the V1 nerve, the ophthalmic division of the trigeminal nerve, which is the sensory for the scalp, forehead here, and the scalp region, and even to the medial side here of the nose, and even the nasal bridge. So here is the infection of the right V1 nerve, the ophthalmic division of the trigeminal nerve, and you can see it is a dermatomal distribution of infection with the branches and the twigs of the ophthalmic division, not more. You can see a clear-cut differentiating region between the right and left ophthalmic distribution, and even between the right V1 and V2 distribution of the ophthalmic and maxillary nerve. So this is the herpes zoster infection, a dermatomal distribution with the branches of the ophthalmic division of the trigeminal nerve. This is the last slide for the lecture, and I hope you have some important points regarding the anatomy of the face. Actually, a lot of details not mentioned, but we are, I think, restricted to the important and relative points to your stage of medical study. Thanks and goodbye.